Show you how you can fix bunions without surgery by focusing on the most common cause, your shoes. All right, let's get started.
Get up and get down, get up and get down.
Today's video is all about bunions. Now, something that's not talked about enough, especially by podiatrists, is that narrow shoes are the main cause of bunions. Here's how you know. I want you to take the shoe liner out of your shoe, and I want you to stand on it. Now, get your foot entirely within the liner because that's the way your foot is positioned within the shoe. And you can see right here, notice the position of my big toe. My foot wants to duck in right here. My big toe has to be angled in order to fit within the shoe. That's what creates this excessive appearance of bony growth right here called a bunion. So let's talk about the anatomy of a bunion. We're going to use our model Tommy here right now. When you were born, your foot had every single one of these toes directly in line with the metatarsal. In fact, if you look at the picture of your footprint when you first left the hospital, your toes were the widest part of your entire foot. Now, what happens is that over time, because we wear narrow shoes, most people in society, it negatively adapts your foot to the position in function of the shoe. So that big toe slowly over time gets smashed in and develops what's called a bunion. Now, what exactly is a bunion? A lot of people believe it to be an excessive bony overgrowth in that first metatarsal joint. But what we find is it's actually a slight dislocation of that joint because of the position the foot has been held within the shoe for such a long time. So it's not necessarily a bony overgrowth, but a slight dislocation of that joint. Now, what happens is that over time it becomes more built up, it becomes painful in some people, but we can always trace back, for most people, the main cause is not hereditary. It's not something that you inherited from your mom or your grandma or your grandpa, but it's due to the type of shoes that you wear. And this is something that we've seen documented in many scientific articles dating back hundreds of years, is that it all comes down to the type of shoes that you wear. Now, if you're in the case that I was in years ago, I first started learning a lot about this. You can see that on my feet, this is the position that my feet were in when I first started learning about this. You can see the excessive appearance of excessive growth on that inside part. My big toe was smashed in like that. And this is something that I first started learning. Now you can see I can spread my toes back out into the position where it should be, where that big toe should be straight in line with the metatarsal. This is something that developed in my feet because of years of wearing narrow shoes. I played baseball my entire life, football. Cleats are extremely narrow. I started competing in Olympic weightlifting in 2005. All weightlifting shoes are extremely narrow. And for a lot of people, they develop bunions because of the narrow toe box. It is an adaptation. So the first step in fixing the problem so that you don't have to go through a surgery is to change your shoes. Now, what does that mean? We need to find shoes that are widest at the toes. Here's a bunch of options, many that I have shared before. Vivo Barefoot. We have the Barefoot Athletics Ursus. We have the Zeros. We have Field Grounds. Every single one of these brands, and there's many more out there like Lems, they all create shoes that are widest at the toes. That's the first step, is actually addressing the cause, because many people want to get a quick Band-Aid fix by having surgery, and they don't actually realize that the cause is the narrow shoe in the first place. That's why a lot of people after surgery, they go right back into their narrow shoes, and for some people, they have to have another surgery. The bunion comes right back because they're not addressing the cause. But once you address the cause, what do? We can actually speed up the process of adaptation, of going back to the way your foot was naturally designed to look, by doing a couple different exercises. Now, let's first talk about what different things we can affect. When the foot has been negatively adapted to the shoe, when your toe has been smashed in like this for such a long time, a couple compensations occur. First, you have a muscle that runs on the inside part of your toe called your adductor hallucis muscle. So its job is to adduct the toe, so pull it in close like that. That muscle becomes stiff and short. whereas the muscle on the outside part of your foot, called your abductor hallucis, which is designed to abduct the toe, bring it back onto natural alignment, it becomes long and weak. So the first thing we can do is affect both of those by trying to help reapproximate the toe back out. So here's how you do that. The first one, we're going to work on the adductor hallucis muscle. So in this position, you can see this muscle is going to run right up through here. What I'm going to do is take my toe and I'm going to pull it out to the side, and I'm going to take my thumb, and right in between my first and second toes runs that muscle, and I can do a little bit of soft tissue work. So I can sort of push down into that tissue while I then stretch out to the side. So this is a form of ART, sort of active release technique, where we are pushing some pressure into that tissue and then loading it out to the side. So this can be a helpful way to improve the flexibility of that muscle, the adductor hallucis. So that's step one, is some soft tissue work and some stretching to that muscle that often becomes stiff and short. Now, step two, let's work on the other muscle, which is your abductor hallucis. This is something that I've seen by a number of different Instagram accounts that show us proper foot function. So I'll link to those below. But what you're going to do is take a band, put it over one part, and we're going to put this right over the top of your toe like that. Now, with this band, it's sort of pulling the toe out to the side, so it's approximating the toe into the position that we're looking for. And then from right here, we can just sort of take a step, hold, and back. What I'm doing with this is teaching my body how to align the toe in the correct anatomical position when I'm moving. So I'm weight bearing and loading the foot with the foot in its natural position. Again, big toe in direct alignment with the first metatarsal. And when this happens, the reason this is so important to have that toe spread out is because when the toe is in a spread out position, it allows me to have better control of my arch and the rest of my foot. So if you're someone that has a problem with pronation, excessive pronation, get that toe out to the side with an exercise like this can be very, very helpful. Let me just show you how helpful that can be. When the toe is pinched together, like it is on top of most shoes that are very normal and pinch your toes together, a excessive amount of pronation can occur. That foot can just collapse right over like this. But if I spread my toes out like they're designed, obviously you can see it doesn't even fit within the Nike. But look at this, it just does not want to move. It will not collapse over into excessive pronation. So that shows to have that big toe in better alignment with the rest of the foot. So right now, so far, what have we done? We've understood that the cause of most people's bunions is the toe or the shoes that do not fit them correctly. They are way too narrow in the toe box. So the first step has to be changing your shoes and getting a shoe that is widest at the toes to allow your toes to spread out. For a lot of people, it can take a little bit of time, months, even a few years, but you can see your foot naturally change and become wider with that alone, no other exercises. But we can speed up the process and be a little bit more efficient with some stretches to the muscles that are often stiff and tight, and then also do some strengthening exercises for the muscles that are long and weak. One of my favorite things to also help speed up the process, and something that I also wear on my feet every single day because of, as you saw, I had been working through my own bunion issue due to my shoes, is wearing correct toes. Now these were developed by Dr. Ray McClanahan, and here's what they do. They are a foot-toe orthosis. Basically, they spread out your toes. They're a silicone splint that spread your toes into the position that we want to see. Now, I have spacers in, there's a part for the pinky and then part for the big toe so that you can create a little bit more customized version for what your body needs. But basically what it does is it puts your foot into the position that we want to see. So the toes are aligned better with what we're trying to accomplish, which is a more natural foot position. Now, the interesting thing about the correct toes is they're not like some of the other toe spacers that you'll see on the market where they're just meant to be worn at night. but they're actually meant to be worn while you're moving. So you can wear these while you're squatting. You can wear these while you're walking throughout the day. Obviously, you have to have a pair of shoes that are widest at the toe box, but I wear these throughout my entire day. And then I also wear them when I'm doing a lot of my lifts. Now, I have to obviously take them off when I'm wearing my weightlifting shoes currently, when I'm doing my clean and jerks and snatches, because those are very narrow right now. And until a wide toe box weightlifting shoe gets produced, we do what we can and we try to get into better positions throughout the rest of the day while we are still wearing shoes, which unfortunately, if you're playing, same thing, if you're playing soccer or you're playing football, you can't get around wearing the narrow cleats right now. So we do as best as we can on the other times of the day, and wearing correct toes can be very helpful. Again, guys, this is something that I wear every single day to help change the harmful effects of shoes that have happened to my feet, and I'm sure many of you guys in the past. So in doing so, we can help mitigate the need for a bunion surgery, because we don't want to do that as much as possible. Let's conservatively treat the problem, okay? Let's try to holistically approach and understand the cause, okay? Your foot was designed to have your toes as the widest part of your entire structure. We're not just looking for aesthetics. We understand the function is that when you get your toes to spread out to become the widest part of the foot again, your foot function improves, your stability improves, your ability to walk and to be able to climb or be able to squat improves, because you have better technical proficiency, because you have better stability, better foot function. That's what it's all about. So if you want to improve your bunion, I hope this was